Here at Cook Children's Pediatric Urology Clinic, first and foremost, I'm a surgeon and a physician. That gives me the opportunity to help take care of families and their children who have urologic problems. Our pediatric urology program is known for our work with different teams, our multiple disciplinary teams, specifically nationally recognized for our congenital adrenal hyperplasia program with the endocrinology department and our Spina Bifida department with the Spina Bifida Association, and we're proud of those.
My role in the Spina Bifida clinic here at Cook Children's is focusing primarily on their function. So helping them with their mobility, helping them with braces, equipment, therapy, making sure that they're able to achieve their goals in terms of independence, being able to dress themselves, being able to get around their home, toilet themselves. Whatever their goals are in terms of independence and mobility, that's my goal as well.
Our focus in patients with spina bifida is that we certainly work with different departments, but it's different in spina bifida. There's not a lot of interdisciplinary decision making that needs to be done in terms of what's going on with their orthopedic care, their neurosurgery care, in terms of the urology. But what is really important is these are kids with complex day-to-day issues that affect their whole lives. And so what we want to try and do best is ease the burden and make things easier for them and do whatever we can to maximize their health care.
Behavioral health is really important in spina bifida because we know from the literature that kids who have chronic medical conditions but who have the best emotional, behavioral, and social functioning in the long run are the kids whose parents coped really well with the diagnosis. I'm part of that team, and so I can make sure that the kids are able to be successful because they're having their physical needs met as well as their academic needs.
We work together with the endocrinology department in a program for congenital adrenal hyperplasia. It's a multidisciplinary collaborative in which we're able to bring the highest level of understanding and newest research to these kids and these families who have complex problems and often have very challenging decisions to make in their treatment. On occasion, this does result in being able to counsel them on the risks and benefits and options for surgery. And often this means just being able to support them early on during their understanding of this condition that is a lifelong condition. And being able to work closely with the endocrinology department helps us best deliver the care that is going to be individual and that these kids need, and often support the families through those things.
When children with CAH are treated within an interdisciplinary team, we're addressing all of their needs, not just their medical needs, but their psychosocial needs, their educational needs, and how they can adjust and adapt to their chronic illness so that they're not inhibited by it. For instance, we have children who sometimes study abroad or travel the world, play sports. We want to make sure that we're providing them the support, care, and education so that their CAH does not get in their way.
The collaborative effort here at Cook Children's is one that really helps our families ensure that their kids are receiving the appropriate care in a timely way. These kids need routine health maintenance exams, ultrasounds, labs, maintenance on their equipment, new orthotics every 6 months to a year. And so by coming to one stop, they're able to meet with each of their specialists, get all of their routine care. We make sure that we work as a group to ensure that their outcomes are optimal.
But the thing that I like most is my role here is I fancy myself as an educator. I get to help families and kids understand how urologic problems are affecting their life and what options and things that we can do, sometimes surgery, sometimes not, sometimes really simple things, sometimes really pretty complex things, and that can help improve their health and hopefully their quality of life.
The best thing about my job is seeing kids take their first steps, seeing the look on a patient's face when they realize that they have the ability to move, to go to school, to make friends, to get a job, to graduate high school. Those things really excite me and excite the team here at Cook. We love when our parents come in and tell us that they thought that their child would never be able to walk or never be able to be independent, and their child just got their first job. Their child is now driving. Their child is graduating high school and picking a major in college. These things are super exciting for us, just like they are for the parents, and just like they are for the children.